Credo Voices, the podcast where we bring you inspiring stories of ordinary people doing extraordinary things. I'm your host, Awele Okibo, the CEO of Credo Advisory.
For generations, youth mental health has been neglected, forcing families to navigate a system that is often inaccessible and ineffective. According to a report by National Survey of Children's Health, NSCH, more than 5.3 million adolescents ages 12 to 17 years, 20.3% of adolescents, had a current diagnosed mental or behavioral health condition in 2023. Across the United States, millions of children struggle to get the mental health care they need, with insurance gaps, policy failures, and systemic barriers standing in the way. On today's episode of Credo Voices, we sit down with Heidi Baskfield, President and CEO of Speak Our Minds, a nonprofit fighting to transform the youth mental health system. Heidi sheds light on the urgent need for policy reform, the everyday struggles families face, and the innovative solutions her organization is championing. Through their work, Speak Our Minds is advancing SDG 3, Good Health and Well-Being, and SDG 10, Reduced Inequalities, ensuring that mental health care is accessible, equitable, and effective.
Thanks so much, Awele. I'm Heidi Baskfield, President and CEO of Speak Our Minds, a nonprofit dedicated to ending the youth mental health crisis.
Thank you. Now, can you tell me, Heidi, how did you actually get into the mental health? What drives your passion for mental health advocacy? I have it on good authority that you are, you're distinguished in law, politics, policy. How did you catch the mental health bug, if I may?
Yeah, so it started back in my 20s when I was a young attorney. I ended up working with a lot of youth who needed support, having the services that they were entitled to provided to them in different settings, like schools and youth correctional facilities and places like that. And I kept seeing some really horrifying outcomes. I saw kids being restrained and locked up and secluded and even tased as a result of their mental health condition. And so that's when I decided I was going to do work to change that for them and their families.
Wow. Heidi, I actually have a personal tragedy. My cousin was actually shot by police, and he had a mental health issue, and it wasn't recognized by the police when it was happening, and he was killed. So this is something that is quite personal for me, and I really do want to commend you and other people who are really dedicating themselves to address this issue. It's a lot bigger than we realize. Tell me a little bit about Speak Our Minds as an organization. What are some of the programs or initiatives you guys are implementing? And what are the challenges you're really trying to solve?
Yeah, thank you. And one, I'm so sorry about that experience. And there's way too many people that share in having those kinds of experiences even today. And so it is those experiences coupled with other things that I have seen that definitely fuels the work that we're doing. Awele, Speak Our Minds is really dedicated to building a working system of youth mental health care. And we got our start because many children's hospitals in the United States came together during COVID to really sound the alarm for the youth mental health crisis, to say, we are being overwhelmed by the amount of young people needing youth mental health care. We are being overwhelmed because there aren't enough of us in the mix providing these services. And once we get these kids stabilized and go to hand them off to the other kinds of services that need to support them in the community, they don't exist. And so children's hospitals really were trying to bring attention to that, to say the system isn't there. And as a result, we're really being overwhelmed and we need to do something about that now. And so after being very successful in raising attention on the topic, the next thing was to say, okay, we've sounded the alarm. Now what are we going to do? And
Yes,
so it
right.
was these hospitals really coming together to say, let's figure out how to build this system. And so that's what Speak Our Minds is about, is how do we build this working system? And we're doing that through a couple of ways. If I may briefly state, we're working to ensure that Medicaid, which is the largest insurer of kids in the country, works for kids and
Yes.
really make sure that they have access to the care. And also, we're coming up with solutions for kids in the United States who have commercial insurance, because so often commercial insurance doesn't provide the coverage that kids need when it comes to their youth mental health services. And then third, we're addressing quality and safety. So when you think of physical health in the United States, most commonly, there are whole teams and companies and systems dedicated to making sure that young people aren't harmed in the provision of their physical health care, right? That we give them the right medication, or we operate on the right things, or we match them up with the right qualified provider. We don't have any of that in the context of mental health. So we're working to address all of that.
That's incredible, Heidi. Now, you talked about working with hospitals. You talked about, healthcare provision through insurance companies. Can you tell me, what are you guys doing on the government side? That's the policy. Because if you don't have the right policy reforms, that's going to the enabling environment for the insurance companies, be it Medicaid or even the commercial insurance companies. It's not going to work. So, can you share a little bit about some of the change or some of the reform measures you're trying to address working with government?
Sure. So, because Medicaid is a government program and it's run differently within each state, our focus is on ensuring that policy is in place to really hold states accountable to running their Medicaid programs effectively. There's a specific benefit within Medicaid, and most states don't implement it. So we're
Wow.
either advocating for effective implementation of those things by working directly with state Medicaid agencies to encourage their thoughtful implementation, or when we have to, we engage in legal action. And an example being, we sued the state of Colorado for failing to adequately implement a statutory requirement when it comes to youth mental health. And we've settled that lawsuit successfully, and we are now working on major reforms.
That is incredible.
Yeah, thank you.
Congratulations. When I hear stories like this, it really gives me hope, and I hope it inspires, people. It can be quite daunting, especially when you're taking on government. Here you are trying
Yeah.
to, advocacy group and taking on some of these big actors, be it government, be it in big, insurance companies. It can be quite daunting. So the fact that you're able to have that kind of success to drive change is remarkable. It's really remarkable. Now, can you tell me, you've been doing this for a number of years now. You've talked about working with government through Medicaid, state and federal levels, as well as with hospitals. Can you share a little bit about the community? I want our audience to get a really good understanding of the different groups that you work with. Yeah? So at the community level, can you share a little bit more? Thank you.
Sure, absolutely. Yes. So a good example would be, now that we've won this lawsuit, there's a whole huge settlement agreement that has to be advanced with the state. And what that settlement agreement is doing is saying, we are going to completely reform how we provide youth mental health care to over 500,000 youth in the state of Colorado. And the way we work with community is to do regular stakeholder engagements to give voice to all kinds of different members of the community to ensure that how they are saying that they need to access youth mental health and how that care needs to be delivered is being, in fact, woven into the state's now new plan to deliver youth mental health. So we just recently had 14 stakeholder engagement sessions, some of which were multilingual, to be able to target as many different inclusive voices to ensure that they are at the table telling the state, here's our experience, here is what we need to have happen, and we will continue
Oh, that's
doing that kind
excellent.
of work. So that would be one example of how we engage community, is just making sure that we're a direct bridge between ourselves and the state and the attorneys working on this case
So
throughout
Heidi,
the
this
process.
there's a lot to unpack here, and I love what I'm hearing. So in that bridge role, and you just talked about how you're driving engagement within the communities. So let us say you have that mother. She's 32-year old, bilingual, maybe Spanish first speak, as a mother tongue, first language. How do you engage with her to make sure that her 13-year-old son who has mental health challenges gets the care she needs? So let's situate it and let's use this example of this. How does your organization help her?
Sure. So we work through organizations, Spanish speaking organizations on the ground that are supporting Spanish speaking families, to be able to have them invite moms like the one that you're talking about to participate with us in our stakeholder sessions. And we make sure that multilingual,
Yes,
bilingual, Spanish speaking
yes.
facilitators and or translators are engaged with us real time, so that inclusion is real time and as effective as we can make it.
So is it more around these are your rights? This is what you should be able to get from your insurance company, or these are the people you should be asking to provide support to your son. I like to put a little bit more color on that.
Sure. The way the engagement works is saying, yes, in part, these are your rights. It's also saying there's been this lawsuit, and now the state has to do the following things differently. And then getting input to say, how would you like to experience this? What has your experience been so far? What would need to change in order for these kinds of things within the system to occur differently, for it to work for you and your son?
I really want to make a point of this because in my line of work, community-led and community-driven interventions are so key. You have a lot of different actors coming in to provide solutions to, whatever problem. They think they know what the community needs, but a lot of times they miss the mark. So what I'm hearing is that you give the beneficiaries, you give the communities the opportunity to provide their feedback. Here's where our shoes are hurting. Here are the challenges we're having. And based on that feedback, Speak Our Minds now understands and is able to be that conduit to communicate, be it to government or to the healthcare providers, to say, here's what these community members need. Here are their challenges. Here's how you should be helping them. Did I capture that?
Yep, that's exactly right. And we couldn't agree more with what you're articulating is a critical philosophy in effective system reform work. If you don't design systems to be part of, not just responsive to, but
Exactly.
part of
Yes.
and
Yes.
living within a
Yes.
community
And this
context,
is the
it
giving
won't
them
ever
the
work.
voice element. They feel that they're part of the solution. They feel heard. And a lot of times it can be such a convoluted system that the average individual may not even know how to navigate that, how to navigate it. They're dealing with, a child who is struggling or a child who's exhibiting certain behaviors or symptoms they may not know. So the work you're doing is so important. Now, so can you tell me, we've talked about government, we've talked about how you're advocating within the communities. What are some of the trends you're seeing in youth mental health? So from when you started your career, there are a lot of things have happened. Can you share a little bit about what trends are emerging? What are some of the challenges? What are the issues that young people are experiencing around mental health?
Sure. Well, I'll say broadly, one of the most common trends is that we are seeing more kids in need of higher levels of mental health intervention, and they are starting to need those at a much younger age. And so
Wow.
when you think about needs that could be primarily met within your primary care provider's office, many more kids are now requiring much more specialized level of care, and as young as
Wow.
6, 7, 8 years old. We're also seeing, I think, much more commonly, unfortunately, suicide as a leading cause of death for young people. We did not used to
Wow.
see that. And so the commonality of that trend should continue to be something that motivates everybody to do this differently and to be responsive. I think also another difference in trend and theme that we're seeing now is that as we're having more conversations about racism,
Yes.
for example, being able to understand how racism in and of itself is a multiplier of a mental health condition that young people of color experience often, and that the system needs to be responsive to that, to be able to create the space for young people to talk about how things like the social context of
Yes.
racism impacts them, and how it creates a different kind of anxiety and depression
Yes.
and trauma that needs to be effectively responded to.
Heidi Baskfield's work with Speak Our Minds is about more than just reform. It's about rebuilding a system that works for families. She is closing critical gaps, ensuring that Medicaid and commercial insurance policies support accessible care, and pushing for school-based mental health programs. By bridging the divide between policymakers and communities, Heidi is leading the charge for a future where every child can access the mental health support they deserve.
Heidi, thank you for that. So I have I mean, again, as you're speaking, so many things are coming up in my mind. So one, you talked about young people, the trends around, suicide. Do you guys do anything with schools? Because a lot of this, again, with just based on the amount of time young people spend in schools, the influences, some of the stresses they experience. How does Speak Our Minds engage with schools, if any, if there's any engagement?
Sure. Well, the interaction with schools is really when you have an effective working system of Medicaid, then Medicaid dollars flow into schools to allow for schools to hire mental health professionals. And so that is part of the work to ensure that Medicaid functions at its
Yeah.
highest level, because there are programs that allow for that. And you're exactly right. We need to be able to have that kind of system working well within schools and for it to be considered an access point for mental health care. So that's
Okay,
what
and
we're
with
doing.
so many actors, Heidi, government, insurance companies, schools, the community organizations, how do you ensure that these different groups aren't working in silos?
It's a great question. I tend to look at it like a power grid. When you go and you turn on your light switch, the power grid works in a very complicated way to make sure that your lights turn on, but you aren't
Yes.
thinking about that. You just know that when you go to flip the switch, the lights turn on. And so what Speak Our Minds is doing is really building that power
Mhm.
grid so that when you go to
Yeah.
access your mental health care, you're not having to think about all of the different players that have to come together, that have to effectively network in order for those services to be provided to you. All too often right now, when people go to turn on that light switch to access youth mental health care, the lights don't come on. And that's what we are effectively trying to do. And so to be able to get a school to talk to a
Yes.
hospital or a mental health clinic and the insurance provider are all the things that we are responsible for creating in order to have that working power grid for
Wow.
youth mental health.
So on this issue of the working power grid, what redress mechanisms do you guys have in place? So if they're having any challenges, they've made calls to their insurance companies, they're not getting these families aren't getting the support they need. How do they get these issues resolved if they're not getting the proper solutions?
Well, on the Medicaid side, what I would say is there are a couple of different ways in which we support families. The good news about Medicaid being a government program is there are well established complaint and grievance processes that families can use and that require Medicaid
Okay.
to respond. We also are tied into effective family advocacy groups that help families file grievances and have very specific components of their need met. The other piece of this, on the commercial insurance side, I would like to say that we know what to do to be able to meet individual family needs when their commercial
Hmm.
insurance isn't helping them. But unfortunately, because it's a private marketplace, those kinds of things just don't exist, which is why we're working so hard to ensure that families with commercial insurance have
Yes.
other tools that they can tap into
Right.
to get their needs met, because that commercial insurance continues to be this box that is impossible to be able to have individual family needs met in the same way that we can with Medicaid.
And then where's the accountability for these commercial insurance companies?
I would even like to say that lawsuits have helped with that. But even in the space of lawsuits, there have been real um, limitations in being able to get
Wow.
commercial payers
Yeah.
to change their policy. So, what I would say is it continues to be around legislation. And
Hmm.
without sharing too much, but giving maybe a teaser, we'll be doing some interesting work in the state of Colorado with respect to some legislation that we think is going to drive some major change in the way that commercial insurance is accountable to families.
Oh, Heidi, I'm so happy to hear. That's incredible. Wow. And then that's the impact. You mentioned the lawsuits. I mean, that's how systems are reformed and how you drive change. Okay, so you mentioned racism and its impact on the mental health of youth of color. Can you tell me, how do you guys like design and implement policies or recommendations that helps address those specific needs of minority youth, LGBTQ plus youth, low income families, those groups that are either unheard, unseen, on the periphery? How do children in child welfare and juvenile justice systems? How do you guys navigate that? How do you do that?
Yeah, it goes back to that philosophy of serving as a bridge voice and making sure that we are regularly meeting with and providing a platform for communities of color and youth of color to speak on behalf of themselves. Speak Our Minds is much more interested in allowing for the authentic inclusion of those voices instead of speaking on behalf of, but creating the space where they can speak on their own. And so that right now, that is our most effective tool, is being able to allow communities to speak for themselves, and then allowing those who are ensuring for effective system build, requiring that they are responsive to what's being shared with them by working directly with the attorneys who are responsible for making sure the state does what it has to. Otherwise, we go back to the court and we say the state isn't doing what they're supposed to do. And then we have the assistance of the courts to support those communities as well.
Now, Heidi, you shared clearly, your organization is doing a lot of good. It's doing there's you can see the impact. What are some of the challenges? It cannot be as easy as it sounds. What are some of the hurdles that you continuously have to deal with? What are some of the setbacks? You have a successful lawsuit in Colorado. I'm hearing that there's kind of more in the pipeline. What are the difficulties that you face every day?
Yeah, I think the biggest and not surprising are state budgets. I mean, it's very expensive to do this work and to do it well. And at a time when state budgets are about to go through a pretty
Yeah.
significant strain, they're sort of on a lag in the way that they are being impacted by current economic constraints. And so states are about to be engaging in some pretty significant budget cuts. And what we're saying is that even despite those budget cuts, you have to build a bigger, more expensive system of care to meet these needs. And so getting very creative and thoughtful and working as a productive partner to states to help advise in the ways that this can happen is going to be critically important, but it's an inherent obstacle to doing this work well. And I think the other thing too is just states want to design a model that work within the context of what makes the most sense for a government operation. And what we are trying to push on is what makes the most
Oh,
sense for families. And that's a natural conflict because we don't want a system that is like easier for families to try to fit into. We want the
yes.
government to
Yeah.
change, not families. And so that is an inherent tension because government will say, well, we can't do it that way, or we can't do it this way. And our whole job is to say, stop trying to do it the way you've always done it. And we are really looking to revolutionize what has been done to this point and come at it from an entirely
Yes, and
different
it's
way of
that
thinking.
paradigm shift that is often very the challenge when you have an entire system of government and you're trying to get them to pivot and assume a different approach of doing things. That is a
Yes.
gargantuan task, and I can certainly appreciate it. So Heidi, I'm a mother of four teenagers, and I'm very well aware of my need as a parent to ensure that their mental health is intact, is protected, and so on. Social media as a parent is a major challenge, right? And in some, I mean, my husband and I are very intentional about very limited access to social media for our children. Other families come up with their own different ways, right? Now, while you're working with government, with the with the state, with the communities, do you guys do any work around with the families or providing them with tools to say, here's how your youth, your children can improve their mental health, reduce social media time or cyberbullying? What kind of work do you do in that area?
It's a great question, and giving parents tools is critically important, as well as giving kids themselves. And so we are getting ready to launch a whole body of work in this space. And I'll say it's focused on getting kids and families back in touch with play and the power of play. And so how we continue to say the best way to deal with your mental health, one is definitely to limit your screen time, but a lot because of how dependent we've come as a society on our screens, it's not enough just to say less screen time. We actually have to provide instructions
Alternative.
on how to play.
Yeah,
And
very.
so
Yeah.
some of that is um, making sure that we're talking to parents about how to ensure for safe places to play. There are organizations that we will be partnering with that provide resources on how to find accessible, safe places to play for their children year round. We'll be working with schools. This goes back to your conversation earlier about what are we doing in schools? This goes back to schools and saying, are you providing thoughtful approaches to recess? So free play, not using discipline as a taking recess away as a means of discipline. All too often, kids are denied play as discipline when it is in fact exactly what they need.
Right.
So we need that to be different. And we need, on a policy front, we need different approaches financially to support schools in how they're providing physical education and school-based sports. We've privatized kids' sports in such a way that we're making it unattainable for so many families. And for those families who are participating in these private sports leagues, it's expensive, it's over competitive. So it's creating um, mental health challenges as opposed to helping address mental health. And it's creating new physical health injuries that were never intended to be experienced in children. We're having all too many children see orthopedic specialists for sports related injuries because your
Yes,
bodies aren't meant to play that way yet. We're not supposed to train like
absolutely.
we're in the Olympics for fun, you know?
Exactly. Exactly. Heidi, it's incredible. Like, again, as a parent, soccer mom, my kids are active. It's quite interesting seeing the level of play and the intensity where a lot of times you hear kids saying, I actually don't want to, try out for varsity or for junior varsity. And again, it defeats the whole purpose. This is an outlet for them to de-stress, for them to bond, for them to, test themselves physically, mentally. And so how do you work with schools? So do you partner with schools? Is it the school education board? Can you just give me a little bit more information around that engagement with the schools and how receptive are they? Do they realize it? Yes, we do need help. Speak our minds. Yes, please meet with us, come and talk to us. Or are you getting a lot of pushback?
Well, you're going to have me come back and talk about this because we are just starting this journey. So I would love to be able to give you,
Oh, absolutely.
9 months from now perspective
Yes.
on how's it going.
Oh
We're
my
really
goodness.
just at the beginning of this. And so we're hopeful that we're going to have some really great school partners come to the table and say, yes, we want your help. How do we do this?
Oh,
And then have them sort of serve as an example for others.
oh, I cannot wait to hear that. Absolutely. And I'm glad that you guys are obviously intentional about those partnerships. And we look forward to hearing those. Now, just my last question. 5, 10 years from now, what are the long-term goals of Speak Our Mind? What role do you see yourself playing, the organization playing moving forward in the next 10 years?
It would be great if we didn't need to exist anymore, would be my honest answer.
That's a
Success would
fair
be we don't
point.
exist anymore because we
Yes,
were able to build a working system of youth mental
yes,
health. And,
yes.
if kids are able to easily access the youth mental health care that they believe they need for themselves along with their families, that's success. That's how the system should work. It should be as easy as the light switch.
Oh, thank you, Heidi. Thank you for the work you're doing. Your work has been recognized. Vital Voices has recognized you as one of the 50 women who are change agents, who are really disruptors and trying to change systems to work for people, work for different communities. So I commend you on that, and I look forward to checking back in with you and your incredible team at Speak Our Minds. Thank you for joining us.
Thanks for the opportunity to share.
Across the United States, families are in crisis, struggling to find the mental health care their children so desperately need. Systemic failures, financial barriers, and outdated policies often leave young people without the support necessary to thrive. That's why Speak Our Minds is taking action, ensuring that Medicaid and commercial insurance policies prioritize youth mental health, holding states accountable, and amplifying community voices in policy decisions. What sets Heidi Baskfield's work apart is her holistic approach to change. From integrating mental health services into schools to securing critical funding for community programs, she is building a system where families no longer have to struggle alone. By advocating for policy reform, equitable mental health access, and sustainable solutions, we can build a future where every child gets the care they deserve, without barriers, without delays, and without exceptions.
Thank you for listening. Until next time, stay curious and keep believing in the power of your voice. This is Awele Okibo, signing off for Credo Voices.